So I first became interested in medicine a few years ago when I was volunteering at an HIV/AIDS clinic. And a lot of the patients at this clinic were taking antiretroviral drugs. One day, one of the doctors I was working with pulled me aside and basically told me that if not for all the medical advances that had taken place over the last 30 years or so, then almost all of the patients, the dozens of patients we had seen just that day, would almost certainly be dead. And it's only because of the advances made by doctors and scientists in recent years that these people are able to live fulfilling and happy lives. And so that made quite an impression on me. And I kind of thought that there wasn't any vocation that could be more fulfilling than one in medical research. My experience in the HIV/AIDS clinic really made me interested in clinical research. And so when I started medicine, I really wanted to find a lab that would allow me to do that kind of research. And so I started volunteering at the Center for Children's Burns and Trauma Research, which is headed by Professor Roy Kimball. I really enjoy the clinical research that's being done in the burns unit. It's a very research-friendly environment, and the interaction that you can have with the families, as well as the way that you can actually impact care, was very appealing to me at the time. So yeah, absolutely, there is a lot of work involved in doing both an MD and a PhD. I would recommend finding supportive supervisors. That's the most important thing. That's really key, is finding people who understand where the gaps are in the current literature, can you direct you to those gaps, and then provide you the resources necessary to try to answer those questions and fill those gaps.